welcome you out to Bass Rehab and Physical Therapy. We're here today with Whitney Hobbs, Whitney Bass Hobbs. You have spent a lifetime around physical therapy.
I have.
Your entire life has
Yes.
been your family helping people
That's
in our
right.
community get the best quality they can get out of life.
Yes.
Yeah, Whitney, that has to feel good to you.
It does. It does. It is. It's nice to be the third generation to keep it going.
Yeah. Standing out in the lobby a moment ago, just looking around, saw an award from Exchange Club, Golden Keys, Golden Deeds Award for Charles.
Yes.
Back in what, 85, I
Probably
think it was.
so. Yeah, he was always so involved in the community.
Yeah, everybody remembers that older generation. And we want to talk about some of the older generation right now. Some of us getting there, and our Aging American special. And we want to come down and speak to you about ways that you can help better quality of life for seniors. So in recent years, I guess a law had been passed where there's so many visits that a person can come in for without a prescription. Tell me about that.
Yes, so there is, but unfortunately Medicare does not follow that, which is probably this population we're talking about.
Sure.
The majority are going to be
Sure.
on Medicare. But if not, yes, I can see someone for like 8 visits or 3 weeks, whichever comes first, without a prescription. But Medicare, you do have to have something from a doctor, a PA, nurse practitioner.
Yeah. If you have Medicare, if you're in that age group, then more than likely you have a physician, somebody you can call, and they'll write you, they'll refer
any
you.
of them fine. Primary's perfect. That's right.
It's pretty easy,
It
isn't
is. It is.
But there are ways that you can work toward a goal that you may have. Maybe you go on a family vacation, maybe graduation's coming up, something that you want to be able to be a little bit more mobile, and you've had some of the common pains. Now I want to pause right here and say, what are the most common issues that people have, body parts maybe?
Low back pain, neck pain, those are big ones. Knee pain, just general arthritic pain. So yeah, those would probably be our big ones as far as pain goes. Yeah.
And so is a lot of that caused by just wear and tear or lack of mobility?
So a combination. So aging, those changes happen, unfortunately, as we age. And then you do tend to become a little more immobile as you have these aches and pains, which actually makes things worse.
Yeah. So what is a plan of action for someone who may want to come in, who may want to call their primary physician and say, hey, got this coming up. Could you write me a prescription? I want to go to Bass, and I want to try to start to do something to get mobile again.
Yes, so that's exactly what they would do, is they would call the doctor, go see the doctor, whichever, depending on your relationship with your doctor. They send us the order. We get it scheduled for an evaluation. We kind of check things out. We go over those goals with you, and then, we just start working towards that with you.
Yeah. So let's say I've been a little sedentary lately, and I want to come in, and you're going to put me on some machines like this. And
yes, we typically do something like this, the bike or the little floor pedals or something, just to kind of get things moving. Just generalized strengthening, arms, legs, overall transfers.
So this isn't intimidating at all, is it?
No.
Whitney? I mean, there's nothing to it. You just hop on here and pedal, right?
That's right. Go ahead,
Yeah,
Brian.
I think I will. Doggone it. So I'm coming in, and I hadn't been doing too well, so I want to get on here. And all I do is just right here.
That's right.
And I'm gone.
That's right.
And you tell me to get on here for
right.
whatever I can handle.
Yeah, that's right. We start usually with like 10 minutes or so.
10 minutes.
May build you up if we can.
For sure.
Yeah.
Yeah, you work at the pace of the patient,
That's
don't you?
exactly right, yes.
Yeah. So
we
it's
see
whatever.
and if we set it for 10 minutes and we see they can't quite do that, then we stop it. We kind of chart. They did 7 minutes, and then we try to build that as we go.
Yeah,
Yes.
It's an individual plan.
That's right.
For sure.
Absolutely.
So it's just a little bike ride.
That's
We've all done a
right.
bike ride as a kid, right?
Exactly.
And like they say, once you learn how to ride a bike, you always know how to ride a bike.
I actually have people that say that. They say, I hadn't done this since I was a kid.
I was a kid. I love that. So you got basic things like
That's
this,
right.
just
Yes,
a foot pedal.
right.
And then what is this?
This is a
Whitney?
seated elliptical.
Seated elliptical?
Yes, so you can work arms and legs on this one. Yes.
So where does the name elliptical come from, and what's that mean?
That's a good question.
That is a good question, because it's just the movement of the machine.
Yes, it's just that.
So check it out, ladies and gentlemen. All we're doing here,
fluid motion.
yeah, that fluid motion is I've got foot motion.
Oh, no.
I've got arm motion. You won't have to wear a microphone, so you won't have to worry about it. So foot motion, leg motion, just like that.
That's right.
It's pretty basic stuff,
Yes.
isn't it?
For this one, they just sit in the chair and pedal. You can see this bike has a lot of life. It has been used for many years, but it's a good one. So yeah, they just sit in the chair there and pedal their legs.
Yeah.
Same concept.
Yeah.
This one's got a little more resistance on it. So
Yeah. Now the advantage of coming in, Whitney, is that they're monitored.
that's right.
They're not just jumping out
That's
there
right.
at home. They say, "Hey, I'm gonna get a bike. I'm gonna do this,"
That's
and then
right.
you have the, the accident that happens
That's
there, and it
right.
sets you back even
Yes.
farther.
Yes.
Yeah, everything's evaluated, and you
That's
move
right.
forward
And
with
we
it like
watch
that.
them as they do it. Yes.
Yeah. Now, once you kind of come along here, maybe you get on some of the weighted machines.
That's right. Yep. As you progress, we'll add some weight and things. Yeah, this is really good for back, core strengthening. We got a hip strengthener over there, so
Gosh.
that's kind of more advanced for sure. But
So right here's a back machine.
that's right.
And you set the tension, Whitney.
We do. Yep.
It-
We do it. We set it for them. We kind of play around with it. So again, whatever the patient needs, whatever they can handle. Some people get on here and don't do quite as much, and some people get on and tell me to bump that weight up.
Yeah,
So,
how
yeah.
about that? Yeah. And so you let them take it each step. And ladies and gentlemen, I just want to show you how easy it is. I mean, it really is. When you come in, they put you in position. They make sure you're all right. You put on a little belt strap so you don't fall off, anything like that. And you just lean back, and you feel that in your back, and it helps. And you talk
now
about
right there.
just a good stretching
That's-
exercise too, isn't it?
Yes, good for mobility and
Yeah.
strength. Yes.
Yeah, you just fall over here sometimes to do a little back work,
That's
don't
right.
you?
That's right. Yeah, we can.
Yeah.
We can work into some too.
Yeah, and you've helped so many people over time. I mean, just I would say hundreds, but thousands of people
Yes, for sure.
have come through here. Your grandparents help. Your dad.
That's right.
Your mom is.
Yes, she's up
Yeah,
front.
she's up front.
Yes.
She's always here to greet and help, and you guys file all the insurance. You
That's
take
right.
care of everything for them.
They do.
And really, like I say, walk them through. You got one more machine over here now. What's
Okay.
that one?
So that's a hip. We work your hips with
Oh,
that
yeah.
one. And we can do a little bit of knee too. Yes.
Yeah, yeah. And people have a, if you sit around a lot, you have problems with your hips, don't you?
You do.
Your hip
You do.
flexors.
Yeah. So sitting at home, or even people that sit a lot at work, tend to have a lot of hip, back pain, things like that.
So
'cause-
let's talk about that for a moment now. And when we say we do an aging American special,
Mm-hmm.
think about it now. When I hit 50, I'm kind of getting aging. When I'm 55, and you're working so much, and you
Yeah.
sit, and we're all, just about all of us, are working at a computer a lot
That's
these
right.
days. So you sit, and time gets away from you.
Mm-hmm.
It really does. And so if you want to learn some things, if you want to structurally learn it, and not just say, hey, I'm going to start by going to the gym.
Yeah.
Sometimes that's not the
That's
best
right.
advice,
Yes.
is it?
No,
Whitney?
it's not. No. Yeah, I'll have people that come in and say, I Googled this or I Googled that, and then they show me what they've been doing, and we got to
You
take it
walk
back
it
a
back.
notch. Yes, take
Yeah.
it back a notch.
I
but
get it.
Yes.
I get it. But you want to start out on the right foot, so
That's
to
right.
speak. And
That's
so
right.
you call your physician, you get a prescription, you come in for, what is it, 8-10 weeks that you usually get?
It really
it
depends on the
depends.
diagnosis. We typically start somewhere 4 to 6 weeks and kind of see how it's going. If we feel like they're really doing well and making progress, then typically the doctors around here are real good about saying continue on.
Sure. Sure.
So that's kind of that sweet spot where we can tell if they're going to benefit from therapy or if there might need to be another direction or some more evaluation from somebody.
You know this so much better than I do, Whitney, but people will not do the exercises at home.
Yeah, this is
You
true.
can show them, but they need to come
That's-
here, and then they
yes.
need to transfer to the next step,
That's
whether it
right.
be Fairview or...
Yeah, so we typically, if we feel like they're safe enough, we will recommend either a home program or go into the gym. And Silver Sneakers over at Clark's is another great resource here.
Sure
that
it is.
We have
Sure.
in Dublin.
That's a part of your insurance as well.
It
if
is,
you go
yes,
to
it
Silver
is.
Sneakers.
Yes.
But there's a different plan for everybody. Not everybody's the same.
Absolutely.
And one point I'd really like to make to you, ladies and gentlemen, is if you don't have to be 65, 70, but you don't want to get to that
you
point.
Don't. Start it before that.
Yeah, you want to come in, you want to get that prescription, you want to come in, let Bass work with you through some steps and get you started out, and then you can go on over and you can hit that treadmill, man. By that time you can work machines like this one at the gym and feel good about it, because the knowledge and experience that you'll get here will take you to that next step for sure.
Thank you. Yes.
Yeah, we'll take a break. We'll be right back with Whitney.
The Medical Center of Dublin is proud to provide families all over Middle Georgia with primary care services that are hard to find under one roof. Call on our team for the highest quality of health care, family medicine, women's health care, and urgent care open until 8 p.m. Walk-ins are always welcome. If you're sick today, you'll be seen today by one of our physicians. The Medical Center has been serving our community since 1964, providing quality medical care for the entire family. Medical Center, conveniently located on Hillcrest Parkway.
Hi, this is Meg Greer-Evans with Middle Georgia Estate Planning in Dublin, Georgia. If you need assistance with a power of attorney, healthcare directive, will or trust, or if you're thinking about long-term care planning for a nursing home one day, give us a call. We'd be glad to talk with you and see if we can help. Our phone number is 478-272-2885, or visit us online at middlegaestate.planning.com.
My name is Dwayne Jeffers. I've lived in Dublin, Georgia most of my life. This is my brother, Ralph. I kind of help him along as he goes through his issues.
I just got through working on my shoulder, where I did shoulder replacement, and then I fell and broke it. So Janice has worked with me on that, and now she's working on where I fell again and dislocated the little finger, so we're trying to get it back straight. But they've been real nice and couldn't ask for any better service and taking time with us to try to achieve the goal that we both wanted.
The biggest thing with any kind of surgery you have is what therapy you have. It's to follow through with the therapy, and Janice and all of the ones here are great. They all have their own little individual things that they do, and everything is really done in a professional manner. We're at Bass today, and I would just like to say what kind of good service that I have had from them. I've had 2 rotator cuff surgeries. I've had other issues, and they have been top notch. And when I go to my doctor, he don't have to ask me where I'm going, because I don't go anywhere but to Bass.
All right, we welcome you back. Now we've made our way over to what, Whitney?
So this is our anti-gravity treadmill. So it mimics the water, but it uses air. So the idea is that it takes the pressure off of your joints, off of your, from the waist down, even off of your back, because you don't have the pounding on your legs. So it can take pressure off your back. But you get in, it fills up with air, and then we set how much weight comes off of it. So we can take up to 80% of your body weight off.
Jeez.
Yes, and so they get in there. They can walk, they can run, you can exercise in there. So there's the benefit of reduced pain and reduced pressure on the joints, but there's also the benefit of not falling. So these people that are real fearful of falling, or we get in there and zip them in, and they won't hit the ground.
That's awesome.
Yes,
You got a volunteer.
I do. So Rachel's going to get in for us.
Hey, Rachel.
Hey there.
So you
they
got a little
suggest
suit on there,
so
right?
you have to put these shorts on, and then we situated here. Then you have to get zipped in.
Rachel knows how to zip
She's
herself
done it a
in,
few
right?
times. Yeah, she's helped a
Yeah.
few patients get in there, so
Yeah.
yes.
So it comes all the way around your torso
all
there,
the
all the way
way around. We
around.
have to close off so no air leaks
Yeah,
out.
yeah.
There we go. Yep. All right. So then we start it. So she'll hit start, and it just calibrates. So it is getting her weight. So then when we set it, it'll know exactly how much air to put in there. for
Okay.
us.
All right, so it weighs her at 95 pounds.
That's right.
And then it fills up to accommodate.
Yes.
And you see how it's coming full of air. And so that lifts her body, huh?
It does. Yeah, you can kind of see her come up.
How's that feel?
Nice.
Good,
A
good.
lot lighter.
And so this is good for all ages.
It is.
I mean,
It
this is
is.
a rehab for an athlete
It
who's
is.
hurt of.
Yes, we use it for athletes, for pain, post-surgical patients. We've even had some people come. We have like a package where you can just come and run. So people that have, we got a big group that trains for all these Ironmen and marathons and all. So if they just need a day to decrease some.
Sure, sure. So can you walk pretty easily?
All right, so so then you would decrease the weight. So just go to like 50. So we'll put her at like 50% of her weight. So you can see it fills up to where it needs to go.
Look at her lifting up there.
Yes. And then we just start the treadmill. And so you can see them walking, and they can see their feet up here on the TV as well, so they kind of get that visual feedback. Also,
All right.
so there's cameras around. Yeah.
All right, so Whitney, all that pressure came off.
Yes.
And what I'm impressed with is that you say you got people who are in these major competitions and you're wearing your body down.
right.
Obviously, you're wearing your body down. I mean, you're just exhausted sometimes, but you need that movement. You got to keep that movement
That's right.
going.
They got to keep training.
So they
Yes.
come in and they can actually run
They can
whatever
run.
amount of time. If they want to do 10 miles, they do
That's
it right
right.
here.
Yeah.
That's
Yeah,
incredible.
we've had people get in and run for an hour.
Yeah. So again, I got a little age on me. I want to start back running.
Okay.
I get my prescription.
Yes.
I come over here and I say, I love to run. I was a runner. I had a little injury, whatever the case may be for you, ladies and gentlemen. But I want to start back. So they can get in here. They can actually come
Right.
over and get a run in. If it's a mile, and you get that runner's high. Okay,
yeah.
and you want to get there because that's the reward of it all.
That's right.
I mean, it is. And so you can come over here. You can run in this anti-gravity treadmill. You can actually put in the time
Yes.
without all the pain, without all the pressure, and you can actually get that feeling that you need. And that's the motivation you need
that's
to be
right.
successful, isn't it,
And
Whitney?
you can, we can start you, at a lower weight, work you up as we go. It can kind of be a gradual return. And
Yeah,
all
yeah.
that. So,
And you're
yeah.
back at it in no time right
right.
here at Bass. Good job.
Thank you.
We'll be right back. The real advantage is in the results. Rehab Advantage in Sports Medicine, providing physical and occupational therapy. Visit one of our locations in Dublin, Sandersville, or Metter. Understanding the cause is the first step in recovery and returning you to a strong and pain-free life. Rehab Advantage in Sports Medicine, personalized techniques designed around your recovery. Serving our community since 2002. Rehab Advantage in Sports Medicine.
Hello, my name is Paris Williams with Take It to Paris Home Care, your structured family caregiving provider. If you have a disabled loved one that's on Medicaid, did you know that you can get paid? Give us a call at 478-772-3044. We have some amazing team members that will be happy to help you and walk you through this process of getting paid to take care of your loved one. Again, my name is Paris Williams with Take It to Paris Home Care.
All right, making our way around at Bass Rehab and Whitney. Now, this is an area where you do pain management?
Yes, so we do a lot of pain management for folks. That's really kind of the first step, honestly, if they are in pain, is to control that pain so we can get them moving.
Okay.
So there are different interventions and modalities that we can use. So one of the things we do, which I know most people are very familiar with now, is electrical stimulation, or TINs. A lot of people have them at their house now because you can get them on Amazon. So several people that come in and I do it with them, they say, oh yeah, I've done this at home. So, but it's electrical stimulation. You got electrical impulses. We put pads on, hook it up, and it's just like a tingling, good feeling.
Yeah.
The idea is that it blocks the pain receptors and gives some relief from that, and that over time that carries over from visit to visit. That's actually most people's favorite. Is the electrical
TIN?
stimulation.
Okay,
yes.
but to just, I mean, trial and error at home?
I know.
I don't know about that.
I know. It's
Yeah, I think
yes,
I'd want a few
everything's
lessons at
available on
least.
Amazon, but that doesn't mean
It's a good
it's
idea.
a good thing. That's
yeah,
right.
for
yes.
sure. Yeah,
but-
so I'd recommend you to come in and
Yes.
and talk to Bass here. Again, get your prescription from your primary.
That's right.
Get yourself lined up and come on in so your insurance will cover it. But how does this work now?
So we would just put some pads on, like so. We just kind of surround the area that's hurting. So
So if her
if
calves
her calf was hurting, yeah, we would.
or Achilles tendon,
That's
something
right.
like that.
So we just put these pads on, then you hook these leads in. There.
And now you being a professional, you're going to know where to set it.
That's right.
To
yeah,
start
that's
out
the big
with.
thing is if you
Yeah.
get one. I've had people. Actually had somebody the other day said they tried their husbands and that it was not what we did in here. And after we started talking, I said, "Well, that's not the same machine.
Yeah.
It's a different setting." So yes.
Yeah.
You can cause some damage.
Yeah,
if you,
yeah, pain. So
yes. So
you have
once
a
they're on, we turn the machine up. We turn the intensity up to what's comfortable for them, and they tell us when it's comfortable, and then we let it run for 10, 15 minutes or so.
Yeah.
Put some ice or heat with it typically,
Okay.
just to get that pain relief.
Yeah.
Yes.
And that's usually a very basic step, you say.
That's right.
You got to
It
get
is.
rid of, you got to
That's-
manage that pain first,
Yes.
and then you can move into
That's right.
strengthening that area or areas
That's right.
around it to
Yes.
support it, right?
Absolutely.
That's a big thing, isn't it, Whitney?
It is.
Yeah, for sure. How proud are you to be a part of Bass?
Oh, probably there's no words to say how proud I am.
Yeah, yeah. What a legacy that you have, your family has built, and what a blessing it is for you to be able.
really is.
I know. It's special to be a part of a team, to be a part of a family, and to be able to help people throughout our community.
And
Yeah.
I've treated people that my granddad treated, so
Yeah.
it's,
Yeah, that's
they've
special.
seen him, my dad, me, Erica,
Yeah.
my cousin. So
Right.
yeah, there's
Yeah. So if you need rehab, call Bass and come on down and let them help you walk through this process and get through it. And we really do appreciate you.
Thank y'all.
Thank you for having us.
Yes, absolutely.
MedFirst, committed to service and quality care. Visit Middle Georgia's largest medical product showroom and let our professionals demonstrate the latest products, including our at-home oxygen concentrators, and stay on the go with a portable oxygen concentrator. You'll find Middle Georgia's largest complete line of sleep therapy equipment, including CPAPs, BiPAPs, and providing complete lines of equipment along with a respiratory therapist to help you. MedFirst exemplifies customer service with demonstrations of virtually every product we offer. So come by MedFirst Showroom at 1204 Hillcrest Parkway in Dublin, or call us at 478-274-1900.
Townsend Brothers Funeral Home has been serving our community since 1937. Our family will treat your family with grace, dignity, and heartfelt sincerity with an extraordinary level of professionalism. You are our friends, and it is a privilege
to take care of you and your loved one in a time of need. Townsend Brothers Funeral Home, family owned and family focused.
All right, welcome you back, Whitney. We have made our way on around to some other therapy going on. What do we have here?
So here we have our occupational therapist, Janice Adams. This is where a lot of their therapy takes place because they do work a lot of hands, fine motor, things like that at the desk. So she's here. She's going to talk y'all through some things that they might do.
Awesome. How you doing?
I'm good. How are you?
Doing well. Your name's Janice?
Janice.
Hey,
Yes,
Janice.
sir.
This is everyone. This is Janice. Okay, Janice, now, what type of station is this and how do you help?
So here's where if you come to Bass, we'd sit right here and do a hand evaluation. We look at your strength, your coordination, your ability to do your everyday stuff that you need to do. We can make custom splints or orthotics. There's a lot that goes on over here in this small part of the clinic. Yes, sir.
Yeah, a lot of talent over
Yeah,
here. I like it.
yes, sir.
So it's occupational things.
It is. It
Okay.
is. So occupational therapy focuses on exactly that, your daily occupations. It can be at work. It could be at home, being a caregiver for somebody, kids at school, or even, for our older folks, maybe some bathing or dressing, or somebody that's had surgery. They may also have trouble with their basic everyday needs.
Yeah.
So we approach therapy from that point of view and go from there.
Okay.
Yes, sir.
Let's have a little example here.
Yeah. So, this is one way to test like a hand strength. You can, it tells you how strong your hands are in pounds.
Okay.
And based on these findings, we can determine how weak you are and what we need to do to help you and go from there.
Okay.
Yeah, and we're not always able to, we can't fix arthritis and things like that, but we teach people different tips and tricks to be independent in their environment.
Yeah.
So
So you manage it.
yes.
You teach them how to manage it.
Exactly.
Because we all have arthritis, I'm told. We have arthritis in our body. I mean, that's just a fact of life as
Yes.
you age. But a lot of times in the hands you'll get it, and so you need to know hacks on it. You need to know tricks.
Right.
Awesome.
There's all kind of different things to do for pain, for using your hands, whether it's handwriting or eating utensils, or maybe outside in the yard you want to stay active doing your yard work. All kind of suggestions there that we can help with.
I
Yeah.
hope the camera's allowing everybody to pick up the demeanor of you, because you're a very pleasant person.
Oh my.
And so when you come into Bass, this is what you find: very pleasant people to be able to help you. When people come in, it's intimidating a lot of times, isn't it?
It can be, very much so. It's normal to be nervous. You're hurting,
Sure.
and you maybe
don't
you
wanna hurt
don't
anymore.
know us, or you
Yeah.
have to get comfortable here. So that's our goal. We do want to provide a relaxed, enjoyable environment and work with everybody.
Yeah. Seems like your job's very rewarding.
It is very much so.
How long you been here?
Well, I've been at Bass since 1999.
Come on.
Long time. Yes, sir.
I mean, that
Yes.
speaks volumes, doesn't it,
Yes.
Whitney?
Yeah,
It really
very
does.
much enjoy my job.
All
And
of our employees have been here 20 plus years, so even though they're not blood family, it's very much a family thing.
Sure is.
Yes.
All right, another great example.